Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over peri-wound management, the things you must know. But first, if you could smash that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So the importance of peri-wound management, super important. Even though the tissue, it may look very healthy, it is always at risk of complications, okay? And complications to the peri-wound directly affect the wound's ability to heal and whether it's going to get larger or not. Okay, so wound-related factors that can cause damage to the peri-wound include exudate, so the drainage coming from the wound, bacterial infections, and dressing-related allergic reactions. Okay, it can all cause damage to that peri-wound tissue, so the tissue around the wound, and if not taken care of quite quickly, it will cause a wound to get larger, okay? So damage to the peri-wound is associated with delayed wound healing, increased size of the wound, reduction of quality of life. It also increases pain and discomfort, okay? So like I said, they need to be managed in a timely manner. So we'll just go over some of the problems with the peri-wound that you might encounter, the most frequent problems. So wound maceration, this is caused from exudate or drainage coming from the wound and sitting around the peri-wound tissue, causing tissue breakdown. So the fluids from the wound is causing tissue breakdown. This will cause the wound to get bigger, okay? Dry skin. So dry, flaky, itchy skin is also another problem encountered. It does provide a really good point of entry for bacteria. So we want to make sure that we're moisturizing that peri-wound, making sure it's not too dry and flaky, or it's a great point of entry for bacteria. Allergic reactions. So we need to be noticing if we're having that red kind of bubbly after like right where a dressing is sitting. We got to look at what we're using because it's causing an allergic reaction. This is no good. It's going to cause tissue breakdown. Okay, adherence of wound dressings. So some material, wound material, they're adhesives, okay, over the entire surface area that you're putting over that wound. So if we have fragile skin, we have to be super careful using these products because it can cause damage when you go to take it off. So just always be aware of that. Even without fragile skin, I have seen damage caused by these, especially if they're being changed too frequent. And then we have eczema. So that's our red, itchy, inflamed skin around the wound. Once again, use our creams to take care of that issue. So principles of peri-wound management. So protecting the peri-wound from external trauma or chemical injury is really the most important step in peri-wound management. So you just want to be carefully assessing on each dressing change to make sure that there is no peri-wound issues. Some basic principles of peri-wound management include treatment of underlying conditions. So if you're having a lot of exudate, we need to manage that, right? Any underlying issues we need to manage. Implement a skincare regime. So if it's really dry or have the eczema, that we're putting on the cream during dressing changes. You want to select an appropriate wound dressing, making sure that they're not allergic to anything in that wound dressing. And if you notice any allergy type rashes or anything like that, that we're changing to a different dressing. Exudate management, and then skin protection. So they do have skin barriers that we can use if we're doing everything in our power and it seems that the tissue's still getting damp or it looks white. We want to make sure that we're managing it using a skin barrier. So I hope you did find this video helpful. And if you haven't done so already and you do find value out of my channel, please hit that subscribe button. And I hope to see you guys in my next video. Bye for now.